Hello. In this video, I would like to provide you with information about a disease called tuberculosis. This disease affects millions of people worldwide each year. There are certain variations between different countries as to how the disease is managed. This is due to the fact that knowledge about tuberculosis varies from country to country, but also because tuberculosis is more common in some countries than in others. Some of the information shown in this video may therefore not be relevant or true for your personal situation. However, all tuberculosis patients have one thing in common. The disease is a pivotal experience and changes the life of nearly everyone who is affected by it and falls ill. This video thus aims to help you to understand what causes tuberculosis, how the disease is diagnosed, and what treatment is needed. In case you are affected yourself, I sincerely hope that you get well soon. Tuberculosis, or TB, is caused by bacteria. These are small and very resilient organisms which can be inhaled unnoticed. This way, the bacteria travel to the lungs where they enter into immune cells. The immune cells are able to eliminate most bacteria, but the bacteria that cause tuberculosis, called Mycobacterium tuberculosis in medical terms, can survive inside the immune cells and even multiply there. The human body recognises these infected cells and tries to eliminate them, which causes an inflammatory response. Some people are able to control the tuberculosis infection for many years or even decades without any medical intervention. They do not develop symptoms and sometimes even recover completely. Unfortunately, the immune system often fails to stop the multiplication of the bacteria, which results in an inflammatory response and then slow progression of the disease, followed by destruction of the lungs and the other organs. The inflammatory response in the body leads to the typical symptoms of tuberculosis. The disease progresses very slowly. Therefore, symptoms can persist for many months before you decide to see a doctor. Typical symptoms are a long-standing cough, fever, night sweats, and weight loss. Some people have to change their sheets several times per night because they sweat so heavily. Many people notice weight loss of up to several kilograms. The typical complaints pointing towards tuberculosis are cough for several weeks, fever, night sweats, and unintentional weight loss. Once they have been inhaled, tuberculosis bacteria are able to multiply in the immune cells of the lungs. Parts of the lung may be destroyed by the human immune system in an attempt to eliminate the infected cells. This leads to holes in the lung tissue that are called cavities, and these are often visible on X-ray. In the cavities, the bacteria are no longer accessible to the immune system. Furthermore, bacteria can be expelled from the cavities into the air when coughing, making a tuberculosis patient contagious to others. As long as patients are infectious to others, the patient and all visitors have to wear protective face masks covering the mouth and nose. Examination of the sputum can usually determine whether or not someone is infectious. Tuberculosis can be treated with antibiotic drugs. Unfortunately, treatment takes many months and requires a lot of stamina. You will have to take a lot of tablets for many months. It is very important that you take your tablets regularly. If you do not take the tablets regularly, the treatment may not be successful. The bacteria will start to multiply again and can become resistant to antibiotics. This leads to an even more complicated and prolonged treatment. In the worst case, the disease can become untreatable and fatal. You can contribute to your recovery with simple measures. It is important not to smoke. Recovery takes longer in smokers than in non-smokers. Also, fresh air and occasional sunlight exposure appear to be helpful. The most important factor is a regular intake of your prescribed medication. This ensures that recovery from tuberculosis can be achieved as fast as possible.